Welcome to another case of 3 minutes cases. This is a case of a 33-year-old woman presenting to the emergency department with headache, nausea, and vomiting. Here are the MRI images. This is the flare and T2 star gradient, and this is the diffusion weighted images. We can see there is areas of hyperintensity on flare and mass effect within the deep gray nuclei and adjacent white matter. There is also on T2 star weighted gradient sequence, there is a susceptibility related signal loss consistent with hemorrhage or venous congestion, and this is demonstrated by the black arrow on the gradient. On T2 on diffusion weighted images, there is focal restricted diffusion in the right thalamus, and in the time of flight MR venogram, it demonstrates absence of flow-related enhancement in the deep venous structures, including the straight sinus, vein of Galen, and internal cerebral veins. This is a case of cerebral venous thrombosis and infarction, and here is a list of differential diagnosis, which may be viral encephalitis or lymphoma, glioma, and maybe also basilar artery or artery of perfusion infarction or occlusion, and also maybe ADEM or acute disseminated encephalomyelitis. Some teaching points on cerebral venous thrombosis. It's a rare cause of stroke and predominantly affecting the young woman. There is some risk factors including oral contraceptives or dehydration or malignancy or some hypercoagulable states. It may be difficult to recognize due to its variability in clinical presentations, and here is imaging, and therefore imaging is critical for early diagnosis and consequently initiation of therapy. These are the venous territories which is essential to know to suggest the diagnosis. In case of deep cerebral veins occlusion, it may show there is infarction of the symmetric deep gray and white matter. In case of superior sagittal sinus, there is parasagittal or parasagittal frontoparietal infarction. And in case of superficial veins like vena flapae, there is posterolateral temporal infarction. Also, the transverse sinuses may show temporal or occipital infarction. These cases are managed using anticoagulation even if there is a substantial intracerebral hemorrhage is present. Thank you.